Te Māori ora, tēnā koe, i te minita. No reira, i ngā kamatua, i ngā kuia, tēnā koto katoa, no reira i ngā mana, i ngā reo i ra rangatinga mā, tēnā koto katoa, talofa rawa, kia orana, ni sabula banaka, and because I'm Chinese, ni men hao, and because I was born in the Pacific Islands, selamat pagi. Look, the minister is a hard act to follow. I really enjoyed his speech. This is my first time coming to talk to you in my official role. I'm really pleased to be here. But I've been here before talking to you, and I really thought hard overnight in terms of what I should say to you. And I looked at the theme of your workshop today is around measurements, evaluation, and outcomes. It's something that is really passionate to me, but perhaps if I start off with an opening remark, and I was wondering whether I should make this an opening remark or closing remark, but I thought I'll make it both, right? And the reason is that the challenges we face are complex. It requires an integrated framework and a coherent approach with a real clarity of purpose, of vision, of mission, with appropriate strategies, supported by a relevant operating model, executed by inspirational leadership that encourages innovation, but reflects who we are in terms of our values and cultures as New Zealanders. It's a very long sentence, and when I wrote it out, I'm quite sure my English teacher would have failed me, because there's no commas, there's no full stop, it's just one big long sentence. But I've written this for myself because for me, every single one of those key words are important to me. And when I look at the theme of measurement and evaluation outcomes, I just want to sort of reflect back to a conversation I had with Dr. Catherine Moore yesterday. Now, if any of you were watching breakfast this morning, you will notice there was a very small clip around the rise of robots in healthcare. Now, Catherine Moore is actually a New Zealander. She now lives in the US. She's one of the leading experts in the world around robotics in surgery in the world, and she is a New Zealander, proud New Zealander. And when I was having a chat with her yesterday, I had the privilege of talking to her for well over an hour. And one of the things we talked about was actually about evaluation, about measurement, and about outcomes. And one of the things we did agree on, and this is where we both were working on quite dangerous grounds, was that the way we were expressing those views runs the risk of upsetting quite a lot of people. But if I do that this morning, I apologize. I want to apologize to you first before I say those things. What we were sharing was to say that perhaps the current way around we do measurement, evaluation, and looking at outcomes is actually holding us back in terms of making progress. It is taking too long. We take years before we see anything comes out. And when it comes out, we're not quite sure what to do with it. And I would suggest to you that the approach we're taking with that may have been suitable if our challenges were complicated, not complex. Now, the reason why I make the distinction between complicated and complex is because the challenges we face today in terms of a changing demographics, in terms of aging population, mix of ethnicity, in terms of the urban drift, the environmental factors, and so on, are complex issues. They are not complicated issues. And complex challenges need a different approach to addressing them compared to complicated challenges. And I'll put it to you that a complex challenge needs to be addressed through a discovery approach, where we need to have a portfolio of safe-to-fail initiatives where your evaluation and monitoring is happening concurrently, and you're making adjustments as you're going. That is quite different from having to actually look at evaluation a year, 2 years after the fact. We take 12 months before we come up with something, and after that we have set up committees to actually look at what we do with those evaluation results. It's far too slow. The world moves on so quickly, and the multifactorial things that affects complex issues are constantly changing and constantly having new factors arriving. So So that's a point I want to leave with you, and a challenge I want to leave with you. The other thing we talked about was around the clarity in terms of how evaluation fits within a whole process of an operating model. Now, it's kind of a jargony word, but in my mind, I try to make these things simple for myself, right? And what I mean, my understanding of operating model is that if we want to make a difference, the first thing we have to ask ourselves is, who are our customers in plural? Because there's no such thing as a singular customer. And that's a lesson I got taught very well by Peter Glensaw when I was the chief executive at Hutt Valley DHB, where he impressed upon me by taking me out to lots and lots of evening meetings with lots and lots of community groups, that if I was to do my job well as the chief executive of the DHBs, it was imperative that I understood there are many, many communities, and within each community are many, many family units. And if I wanted to do my job well, I had to understand their needs. So first thing is, who are the customers and what are their needs? And we don't formulate and understand the needs by actually talking to ourselves. We actually formulate and understand the needs by talking to them. And in the first instance, they may not be very articulate. And the reason why is that they kind of don't trust us. I understood it very well because Peter said to me, lose that suit and tie. Right? The next thing then, if having understood the need, one of our big challenges is, what is a good outcome for them? What does good outcome mean for them? Again, it has to come from them, not from us. And having understood their need and what good outcome means, then we think about what are the services that can be designed and implemented to actually deliver the outcome that meets their needs. Next step comes is the issues around measurements, performance, and evaluation. We have to have a good understanding of that in terms of how it links back to the outcomes that will address the need of the customers. Often, there is a disconnect between the service design actually with the outcome, and there's a disconnect between the evaluation and the performance measures with the service and the outcome. When we get through all that, then comes a really hard bit around how we would then organize ourselves in terms of processes, structures, funding, contracts, workforce, IT, facilities, technology, etc., etc. Those things are, in my mind, some of the basic fundamental steps of how an operating model works. And it's really important. We forget the word operating model is a jargony thing. But if we wanted to make a difference, those steps are fundamental. And it's not a intellectual or sort of a MBA textbook style. You just get the checklist on tick, 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 this sort of stuff. Because fundamentally, each of those steps actually, if we do it well, should challenge our mindset and influence our behaviors. And I'll put it to all of us here, our biggest challenge is actually changing our mindset and our behaviors. Often, I think we know what is the right thing to do. The thing that stands in our way is our mindset and our inability to change our behaviors. So, I'm not going to take any more part of the meeting. So, this is what I've been reflecting on in terms of what I want to share with you. But I thought I'd close that by telling you a little bit of a story around Wednesday. Wednesday was kind of a really interesting meeting because the night before I was informed that one of my senior staff, and many of you actually know Don, passed away. So I was feeling, I don't know what I was feeling, but I knew I wasn't right. But Wednesday we also had a kind of big meeting, and Minister, you were there around the SOC meeting talking about an obesity package, and that was a very uplifting conversation for me because it was an important agenda that we were working on. And later that day, I had to travel to Levin to support Peter Hughes and Brendan Boyle to actually talk to the Levin community around what they were doing around the social sector trial, Whānau Ora, and the children's team. The good thing about that meeting was we actually got to meet the kids that we were trying to actually help. And that to me was much more powerful because after meeting the kids, we went and sat and had a discussion with a local governance group. And I actually said to them, where are the children around this table? They were trying to help. I see lots of committed, well-intended community leaders, but where are the consumers that we are trying to help around this table? Or are you trying to actually say what's good for them from your perspective? Interestingly, I was wondering whether I would get out there alive and making that bold challenge, but there was a lot of nodding of the heads around the table, which I was quite glad about. So I'll just close in terms of how the day finished, right? So I thought, then I drove back, and I was really thinking about Don, in terms of his passing and what it meant for not just the ministry but the broader public service. And I was coming up to, I think it was Waikanai or Paraparama. I can't remember. I should be concerned about driving. I was thinking of Don. And confession to make, so I went through a 50-kilometer zone at 74 kilometers. And the next thing I knew, these bright lights kept flashing at the back. and I sort of parked quickly, and I said, Mea culpa, Mr. Policeman, just give me my ticket. I just need to move on. But look, the reason why I share that is that this thing matters. It's our ability to think about what it means and affect individual in their lives, right? So, and the reason I'm sharing with you around Don is because although he's moved on, he leaves behind a legacy, and Don's legacy was his passion to make a difference in the public service to serve every single New Zealander. And in one of the email I got from a fellow chief executive, she said, Don was the perfect consummate public servant. He had a beautiful mind and an even gentler heart. Nō reira, tēnā koutou katoa.